Hi everyone, welcome and thank you so much for attending this presentation. My presentation is going to be on methamphetamine addiction in San Diego County. So first we're going to start off with a little introduction. The problem at hand here is that methamphetamine abuse is a public health issue and continues. Hi everyone, welcome to the presentation. Thank you so much for joining me for my topic of methamphetamine addiction in San Diego County. A little introduction to the issue at hand. Methamphetamine abuse is a public health issue, and the issue continues to grow in areas like San Diego County. San Diego County is the southwesternmost county in California, sharing a border with Mexico. In 2015, the population was over 3.3 million, 11% of these citizens having military veteran status, 14% living below the poverty line, and about 75% of them being either white or Hispanic in ethnicity. San Diego experienced a record number of methamphetamine deaths in the same year, and this was an 82% increase from 2011. Some stats regarding methamphetamine abuse in the U.S. as a whole. In 2012, a national survey found that 1.2 million people reported methamphetamine abuse in the year prior, and 44,000 of them in just the month prior. Methamphetamine is most commonly smoked, putting the drug into the bloodstream quickly, which does result in a long-lasting high followed by a crash. While national trends are showing decline overall in the country, methamphetamine abuse continues to exhibit regional variability, and this variability is most prominent on the West Coast and in the Midwest. Here are some of the effects of meth, both short-term and long-term. Most notably, again, meth has a significant high associated with it, and there are some negatives definitely associated with that high, including rapid and irregular heartbeat, hyperthermia, as well as increased respiration. In long term, of course, there's the risk of addiction, as well as psychosis and other mental disorders, memory loss, changes in brain function and structure, as well as severe mood disturbances and prone to violence. So based on the issue, let's take a look at some current efforts that are being done. So working toward a solution, we have the national government as well as county-based efforts in order to work toward a solution for methamphetamine addiction. Nationally, we have the National Institute on Drug Abuse, or the NIDA, which is a sector of the U.S. Department of Health and Human Services. They work to advance science through addiction study, and they are diligent in providing information to improve lives of individuals in national public health, and they have countless resources on their website regarding methamphetamine abuse, symptoms, and treatment options. There's also the Substance Abuse and Mental Health Services Administration, or the SAMHSA. This is also a sector of the U.S. Department of Health and Human Services, and their mission is to reduce the impact of substance abuse and mental illness in American communities by increasing awareness and access to resources and treatment. So this website as well has some great resources, and they prioritize partnerships with local organizations as well to solve problems in the substance abuse category and mental health category. Locally, we have some diligent organizations like the Meth Strike Force. This is a multidisciplinary organization that's located right in San Diego County, and it's a conglomeration of 70 members, including local and federal public health organizations, law enforcement, education, and they focus on treatment and prevention. They provide educational resources and treatment options on their website, as well as a crisis hotline for those who may be struggling with substance abuse, specifically methamphetamine, or if someone knows someone and it's their loved one needing assistance. There's also the Alcohol and Other Drug Services. It's a San Diego County-based organization as well, rooted in the Health and Services Agency for the county specifically. and they provide dozens of resources on their website, actually including the Meth Strike Force, which goes to show their presence in the community and their reliability as an organization. So next, let's take a look at how these objectives, or this problem, is supported by national objectives. So the Healthy People 2020 is a group of objectives set up by the U.S. Department of Health and Human Services. In regards to substance abuse specifically, the goal of Healthy People 2020 sets out to reduce substance abuse to protect the health, safety, and quality of life for all, especially for children. Here are a few of their specific goals within the substance abuse category of Healthy People 2020. They include reducing the use of illicit substances overall, increasing the proportion of adolescents who see risk associated with substance abuse, as well as reducing drug-induced deaths, and increasing the number of admissions to substance abuse treatment programs. So why is this all important so far? So thus far in the presentation, we've been able to see the extent of San Diego County's methamphetamine abuse problem, who is working to provide resources both nationally and locally. And this can allow us to look at the U.S. as a whole and see the need for meth abuse solutions by the inclusion of the topic in its decade-long goals, being the Healthy People 2020 project. It confirms that the issue is relevant, needs addressing, and it points to the overall size of the problem. So due to this issue, I created a community needs assessment based on San Diego County. Here are some of the results. I asked the study participants, 43 people specifically, how big of a problem they believe substance abuse to be in the community. And these are some of the results that I received here in this graph. So taking a look at some further primary data, I was also able to interview Michaela, who's a community volunteer in San Diego County. So part of phase 2 of my needs assessment, I was able to discuss with her the current climate and the needs of San Diego County in regards to substance abuse from a homeless population perspective. She works alongside the homeless in the community, and she sees a great need for partnerships between local organizations and governmental organizations in order to improve awareness in the community as well as resources. So here are some of her thoughts regarding the issue specifically. Now here I'd like to provide some further data retrieved from the community needs assessment. So we have a few questions here that were asked of the 43 participants of the study, and it was, how big of a problem says substance abuse is in the community? What do they believe contributes most significantly to the problem of substance abuse, and who is responsible for providing resources and support for those struggling with substance abuse? And here are some of the results. You can see here that we have a diverse perspective on what might contribute most significantly to substance abuse, and also who is responsible for helping to provide programs and resources. So based on that community needs assessment, I was able to see a sort of results and be able to make recommendations from that regarding what the community of San Diego County needs in regards to substance abuse. So in conglomeration with a community assessment as well as the primary data retrieved from survey and interview, I was able to figure out that increased accessibility to community-based resources is going to be important if methamphetamine abuse is to be addressed. Partnerships between national and local organizations are also going to be key in moving forward and making an impact. Increased awareness of substance abuse is also going to be key, and this can be done through ways such as transparency about the problem. Pushing the problem aside in the community will not help solve the problem and will not help create awareness. We're also needing some implementation of improved treatment programs within the community related directly to the accessibility of resources. Here are some recommendations for intervention based on successes in studies that already exist. Cognitive and behavioral therapy have been found to be a very successful method in addressing methamphetamine abuse and substance abuse in general. After just a few sessions through a talk therapy style session, people have found success in using methamphetamines less or stopping abuse altogether. There's also contingency or incentive programs, and this is a type of program that provides a reward for a stopping or reduction of a behavior. One study that I looked at was a 12-week trial of a cash incentive for substance-free biological specimens. So this is a drug-free urine test or blood test, and participants were able to earn up to $400 for these substance-free tests alongside psychosocial counseling and treatment. There's also faith-based treatment. So we also have faith-based treatment as a viable and successful way to address substance abuse. And this is my particular favorite, being that addressing a substance abuse issue requires more than just meeting a physical or a mental need, but a spiritual need as well. And faith-based treatments do tend to look at the person more holistically. And study participants from a study I looked at had very great reviews from the participants and believed that it helped to improve their relationships, helped them to maintain employment, and helped to decrease substance abuse overall. In conclusion, what I've been able to gather from the entire project here and just want to communicate clearly is that methamphetamine abuse is an undebatable problem, both locally in San Diego County, my topic of choice here, as well as nationally. While there are governmental and community resources available, there is definitely a need for increased availability and accessibility to those programs, as well as effective organizational partnerships. Community-based treatment is necessary and can take many forms, such as those faith-based or cognitive behavioral therapies, and addressing more than just the immediate addiction is going to be important for that long-term success. So thanks again for listening. Hopefully this has been informative in maybe a community that was unknown to you or unfamiliar to you, as well as a struggle that is local here to us in Southern California. So thanks for checking in and have a great day.